Dear audience, let me introduce my PhD topic, which is exploring the spectrum of oral disorders in different autoimmune diseases. Patients with Sjögren syndrome often suffer from oral disorders, leading up to 30% of teeth loss with functional, aesthetic, and speech problems. Importantly, neither of the evidence-based guidelines contain suggestions for regular dental visits. However, most of the above-mentioned oral disorders could be preventable or treatable if diagnosed early. In this systematic review and meta-analysis, we show that many of the oral disorders, such as candidiasis, dysphagia, or caries, have a high 20 to 55% prevalence rate. Therefore, physicians are strongly advised to send their patients for regular dental visits, and future research should focus on determining the effectiveness of preventive interventions, and policymakers should ensure that guidelines dealing with patients with Sjogren syndrome contain this suggestion. My name is Ágnes Heizer. I'm a second-year prosthodontist resident at the Department of Preclinical Dentistry, and my vision is to give a better overview on the course of autoimmune diseases, and I would like to reduce the severity of symptoms in these conditions. Currently, we have 2 ongoing projects. Both of them started last year, and using the methodology of systematic review and meta-analysis. The first one is investigating the risk of oral disorders in Sjögren syndrome. If we look at these pictures, we can see a dry, probably very itchy eye, a dry mouth signed with fissure tongue, and also a caries lesion. And if we put these symptoms all together, probably the first diagnosis which comes in mind, considering these symptoms, is Sjögren syndrome. Sjögren syndrome is one of the most frequent autoimmune diseases with a very variable prevalence rate depending on geographical areas. We can differentiate 2 forms of the disease, the primary and the secondary form, where the secondary means that Sjögren syndrome coexists with other autoimmune conditions. One of the most common and unpleasant symptoms is oral dryness, because the secretory activity of the exocrine glands is disrupted by chronic lymphocytic infiltration. Oral dryness not only increases the risk of dental caries, but also contributes to dental erosion. Saliva has a crucial role in protecting teeth, and also a continuous flow of saliva is very important to prevent colonization by Candida. Furthermore, these patients are more prone to develop periodontal disease, so we need tailored treatment protocols that addresses the unique challenges of oral dryness and the associated disorders. Our clinical question: what is the prevalence of different oral disorders in patients with Sjögren syndrome? We use the COCO-POP framework to work with, and we hypothesize that patients with Sjögren syndrome have higher prevalence of oral disorders. And if we provide treatment at an early stage of the disease, we can improve the quality of life. Here you can see my search key. We designed 2 domains. The first one refers to the syndrome, while the second one to all the possible oral disorders which can be obtained in Sjögren syndrome. We conducted our search in 3 databases, and on the right side you can see the flowchart of selection. We started with 13,000 hits, and after the duplicate removal and the title of selection, we ended up with 84 eligible full text. And after the reference chasing, we could say that our search key has found all the articles. And let me present my results. The first one is assess the risk of candidiasis in patients with primary Sjögren syndrome and in controls. So candidiasis is very common in Sjögren syndrome because of the oral dryness, and it is crucial to diagnose the disease and start treatment to prevent further complications. We pull the odds ratio here, where an odds ratio of 1 in the line of no effect. Any greater value than 1 means higher risk, and less than 1 indicates lower risk. In this figure, we analyzed 6 studies with around 2,500 patients, and the heterogeneity is moderate, which can be due to the different types of oral candidiasis. And the odds ratio is 11.67, and this result is statistically significant and clinically relevant. Patients with primary Sjögren syndrome are 11 times more likely to have candidiasis than controls, so clinicians should focus on preventing this disorder. The second figure shows the risk of dysphagia, which is also very common in Sjogren syndrome. It presents as a difficulty of swallowing, so it can easily lead to malnutrition. In this figure, we pulled the odds ratio, and we analyzed 8 studies with around 2,700 patients. Heterogeneity is moderate, which can be due to the subjective behavior of reporting dysphagia. And the odds ratio is 26.78. That means that patients with primary Sjögren syndrome are 26 times more likely to develop dysphagia than controls, and this is also statistically significant result. The last figure shows the mean difference of DMFT. DMFT is a widely used index in dentistry to measure dental health. DMFT stands for decayed, missing, and failed teeth. In this figure, we analyzed 7 studies with more than 400 patients. And the mean difference here is 5.75. That means that patients with primary Sjögren syndrome have 5 more affected teeth than healthy controls. In this slide, I would like to show you my other results. And after the statistical analysis, we could say that most of them statistically significant. The strength of our study is that we present wide range of oral parameters and oral manifestations, and most of the articles also investigated age and gender-matched healthy controls. But we have lack of information about confounding factors, and other limitation could be small sample size. So we could say that patients with primary Sjögren syndrome have higher mean of oral parameters and higher risk for oral disorders. So we should focus on regular dental visits and prevention among these patients. And future research should be done on preventive intervention, and we can establish guidelines for these patients. So currently I'm at the manuscript writing phase. And the second project is investigating the prevalence of oral disorders in systemic lupus erythematosus, which is also a chronic autoimmune disorder, primarily impacting young women. And the complexity of SLE makes it challenging to diagnose because there are remission phases following after flare-ups. But one of the first indicators of the disorder are oral manifestations, which are reported in more than 40% of these patients. It can present various forms of oral manifestations, such as ulcers, cheilitis, candidiasis, serostomia, or the symptoms which comes with serostomia. But these symptoms are often under-recognized in standard SLE care, reflecting a significant unmet need that we need better collaboration between immunologists and dental specialists. The clinical question is exactly the same as in the first one, just we are investigating oral disorders in systemic lupus erythematosus. We use the COCOG-POP framework, and if we recognize these early signs, it can aid in timely diagnosis and therapy. And as a summary, we have these 2 ongoing projects. The planned submission date for the first one is this year, and for the second one next year. And let me finish my presentation with the quote of Stephen Hawking: "One is always a long way from solving a problem until one actually has the answer." Thank you for your attention.
Thank you very much. Are there any questions from the audience, please?
Congratulations on your presentation. My question would be that, do you also investigate the periodontal indexes and the periodontitis?
Thank you for your question. Yes, but because of the short time, I couldn't present it. But we also investigated the mean difference of different periodontal parameters, such as probing pocket depth, bleeding on probing, gingival index, and clinical attachment loss. And we could see that not all of them are statistically significant, but we can see a tendency to be higher in the patient group than in controls.
Thank you very much.
Congratulations for your presentation. My question is regarding your first project that you mentioned that you had controls. Wouldn't it be better to use another framework?
So originally we used the COCO-POP framework because in the beginning we didn't know that if we have enough articles with controls, but we had. So in that case we can use the PECO framework because the risk gives more information than only prevalence.
Thank you.
Thank you.
Congratulations on your presentation. My question is then in both projects in the framework, in the conditions, you listed a lot of dental or mouth diseases. Did you just list all the things that you could find in literature that was in connection with your topic, or did you use some sort of exclusion criteria?
I listed all of the manifestations and symptoms which can be obtained in Sjögren syndrome. Not all of them included in our study because of the lack of information, or we didn't have enough data about it.
Okay, thank you.
Thank you for your presentation. I have a question regarding your first project. So I've seen that very well-structured table with other conditions associated with Sjögren syndrome. I'm curious, did you find any information regarding the parotid gland swelling or the CL adenosis, which is commonly present in these patients?
Yes, some of the articles also included glandular swelling, but there were not enough articles about it, so we couldn't make a forest plot or we couldn't include in our meta-analysis.
Okay, thank you very much.
Thank you for your presentation. My question is that you listed the prevalence in Europe. Does it increase or decrease in Asia or in North America?
So as I mentioned, the prevalence is it's very variable depending on geographical areas. So we can see that higher prevalence in Europe or in North America and lower prevalence rates in Africa and Asia. But it could be because we have not enough studies from Africa or Asia.
Thank you.
Thank you. So congratulations on your presentations. I would like to have 2 questions regarding your first project. I would ask in what stage of Sjögren syndrome do you see these patients, and when the patient is diagnosed with this disease, are they immediately sent to you?
So we can see these symptoms quite early because the most important or the most common symptom of Sjögren syndrome is oral dryness, and that's why they are more prone to develop caries and other lesions. But unfortunately, these patients are not sent to our clinic very often, or yes, some of them come to us for regular dental checks, but yes, it's
okay, thank you.
Not that regular.